Good evening. Today is July 7th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is how US coronavirus cases are rising sharply, but deaths are still down. Right now, cases in the United States are once again on the rise, and states like Arizona, Florida, and Texas are seeing some of the highest numbers to date. The surge shows few signs of stopping even as we hurtle further into the summer. However, the virus appears to be killing fewer of the people it infects. In April and May, COVID-19 has led to as many as 3,000 deaths per day and claimed the lives of roughly 7 to 8% of Americans known to have been infected. The number of daily deaths is now closer to 600, and the death rate is less than 5%. In general, experts see three broad reasons for the downward trend in the rate of the coronavirus: testing, treatment, and a shift in whom the virus is infecting. So the first reason is because testing is on the rise. The nation is administering about 600,000 tests each day, up from the 100,000 per day in early spring. The increased testing has identified many more infected individuals with mild or no symptoms, driving down the overall proportion of patients who die from COVID-19 as they have severe symptoms. With more tests available, infections are often identified earlier, which allows healthcare workers to intervene earlier, and many treatments seem to work best when given well before people are at death's door. As the weeks have gained on, doctors and nurses have also gained a better handle on how to treat the coronavirus, and in several states, emergency departments are no longer overflowing. The second reason is more and better treatments. Healthcare workers have also become more knowledgeable about promising treatments and palliative care options to combat the coronavirus and its effects. For instance, prone positioning, in which case patients are flipped onto their stomachs, can ease respiratory distress by opening up the lungs. There's also new steroids and treatments that appear to reduce deaths among patients with severe COVID-19, such as the steroid dexamethasone and the antiviral drug called remdesivir. There has been also a shifting patient population that the disease is currently targeting. Coronavirus-related hospitalizations increase with age, and elderly individuals remain some of those hardest hit by the coronavirus. Yet, younger people are now making up a growing proportion of cases, and they're much less likely to die from the disease. In Arizona, people ages 20 to 44 now account for nearly half of all cases, and in Florida, the median age of residents testing positive have dropped from 35 to 65. Numerous states recently began reopening their economies, which might be driving some of the useful bias, and also younger people are more likely to socialize, going to restaurants and bars as well. At the same time, elderly individuals may be wary of exposure and are protecting themselves much better or by staying at home, as nursing homes and other facilities that harbor vulnerable populations may be working harder to protect their residents. So for looking ahead, experts think that mask wearing, physical distancing, and hygiene may be reducing the dose of coronavirus that people encounter in the population at large. The amount of the virus that the individuals carry may influence the severity of their symptoms, so just try to stay socially distanced, and you will most likely be safe. The second thing that I'd like to talk about is Sweden. The decision to forego a lockdown in Sweden has expected to spare the country from financial devastation, but it has not worked out that way. Not only is Sweden's death rate from the virus disproportionately high, but its economy has suffered similar to its Scandinavian neighbors, which enacted aggressive early measures to control outbreaks and have had far fewer deaths. So for places hoping for an economic revival as they reopen prematurely or try to avoid another shutdown despite surging new cases, they can look at Sweden as a cautionary case study. The Swedish economy is expected to shrink 4.5% this year, compared to 4.1% in Denmark and 3.9% in Norway. Unemployment has also increased, so Sweden has basically gained nothing. So many have wondering how this could happen in a country that remained open. The virus seemed to be the real enemy of economic prosperity, not stay-at-home orders. However, Sweden's manufacturing sector has been shut down by holes in the supply chain, and while stores and restaurants can continue to welcome consumers, many people have been scared off. That's it. Thank you for listening, and I hope you have a good day. Thank you.